You know what? I'm gonna forgo visiting the Mayo Clinic for a benign cyst and complain about my compassionate and gentle doctor who I chose myself and see whenever my bouts of hypochondria are looking for company.
I'm feeling sick. It's time to get me something quick. I'm quite benign, but that's a sign there's something wrong. And so I sing this horrible song for you. Please help me.
I'm going to do this because while I don't have to pay for health care, and I don't have to worry about an exorbitant co-payment that would prevent me from finding out that my "it's probably just a bad cold" is actually the swine flu, I do have to pay for my own vacations. And I think I'd like to visit Washington for free. And if that means hanging with a bunch of sour Republicans enthralled with my tales of health care woe, even though I don't have any, then whatever! I'll make some shit up.
I don't have a cold. I've got the swine flu. My doctor, they just won't see me. I know the WHO has classified me as, ew, he's got the swine flu. He's got the swine flu.
At that time I was unemployed, depressed, and broke. And I visited my doctor who spent half an hour with me discussing mental health issues and general advice on wellness. Never happened. And my buddy who ruptured his Achilles on a Monday and was having surgery on Wednesday. And by the way, a ruptured Achilles is only life-threatening if you're a Greek god. But still, no 6 months wait for this guy. But don't worry, I won't be telling my Republican host. That's all. Now, this doesn't mean that there aren't problems with the Canadian system. And while it's not as enthralling as Michael Moore thinks it is, I mean, I don't get blown by a candy striper every time I go and get my tonsils removed.
Hey, Mr. Tonsillitis, why don't you touch my tightness? You're making me all drippy with your drippy, drippy drip.
It's certainly not a Soviet-era system replete with rusty speculums and cotton swabs. And so, while not perfect, our response isn't to replace the system, it's to improve it. And there are government committees that are always looking at ways to make it better.
Rusty speculum in my rectulum, chewy bubblegum, anal probulum, rusty speculum, yum, yum, yum.
So I find it fascinating that American critics will root out any flaw and use it as excuse enough to keep the status quo, which, remember, means tens of millions of Americans have no insurance coverage, and millions more have the privilege of being ruined financially in life and death decisions. It's also exceedingly disingenuous to frame the discussion completely around an either-or scenario. If the American system is one extreme and the Canadian system is at the other, then the US has the chance to find the best of both systems and creating something uniquely American. I mean, the Canadian system isn't something that you order and it comes in a crate that you pry open with a hammer and sickle. But again, I won't be sharing that story until after I've been flown to Washington and take a meeting with Republicans, preferably at Ruth's Chris Steakhouse, and after a visit to whatever musical is on at the Kennedy Center. Now that's some shit I can't afford.
Let the poor die young. Who needs them? Let the rich live long. We need them. All those plastic surgeons will not have no work no more. So let the poor die young. Let the poor die young. Let the rich live.